The time and range is a patient-centered approach to measuring glycemic control, which captures the proportion of time that my patient's glucose level is in a safe range, so between 70 and 180 milligrams per deciliter. So as such, time and range is better able to support safe and effective diabetes management than hemoglobin A1C or isolated glucose values that are obtained through self-monitoring. The Ambulatory Glucose Profile, or AGP, helps primary care providers by presenting a high level overview of the patient's glucose patterns over a 24-hour period based on a 14-day pattern. So the AGP shows primary care providers and our patients what their blood sugars are actually doing during the course of the day, and that allows us to effectively and efficiently adjust treatment regimens. It also helps patients identify barriers to control and support better adherence to treatment regimen because it's a much more tangible and interpretable measure of their diabetes control than the A1C or fingerstick glucose values. The AGP also helps primary care providers address the struggle we face all too often by trying to make sense of patients' glucose logs, or worse, scrolling through their glucometer itself. Ideally, primary care providers would partner with certified diabetes care and education specialists, or CDCESs, to care for patients living with diabetes, especially if patients are treated with intensive insulin therapy or are struggling with their glycemic control. CDCESs can dive in deeper into the CGM report, identify nuances in the patient's glycemic management, and make treatment recommendations and dose adjustment. They can also educate patients on the specific aspects of diabetes management that our patients struggle with the most. First, primary care providers can help our patients access and use continuous glucose monitors, both intermittent scan and real-time CGMs, by better understanding the regulatory requirements for CGM initiation and their continued coverage, and by developing systems to meet those requirements. Second, we can teach our patients how to interpret their data by first understanding it ourselves and then thinking out loud during our appointments so that we give our patients the same knowledge that we have when it comes to interpreting the CGM report. And then finally, and really most importantly, we should partner with certified diabetes care and education specialists, refer our patients to them to empower patients to live well with their diabetes.